today is Julie Isaacs. Julie is the Child and Family Policy Fellow at the Brookings Institution and serves as visiting scholar at the Institute for Research on Poverty. Her current research examines investments in children in the federal budget, poverty, and economic mobility. Recent publications include Kids Share, an analysis of federal expenditures on children, the Wisconsin Poverty Report, and Getting Ahead or Losing Ground, Economic Mobility in America. Before joining Brookings in 2006, she was Division Director at the U.S. Department of Health and Human Services, working in the area of human services policies. She also has served as a senior researcher on childhood development and school finance at the American Institutes for Research and budget analyst at the Congressional Budget Office. While at the CBO, she was responsible for analyzing the cost impact of legislation affecting food stamps, child nutrition, child care, and child welfare programs. Ms. Isaacs has a master's in public policy from the University of California at Berkeley and is a foster adoptive parent. Please welcome Julie.
Thank you. It's a pleasure to be here. And I'm somewhat new to Wisconsin. I moved to Madison about 2.5 years ago. So this is my first chance to drive up to this part of the state. And it was dark last night, and I'm looking forward to driving back and seeing more of the state because I studied poverty in Wisconsin, so I know some of the counties by high poverty, but I haven't actually driven through them yet. In the 2 years I've done some driving around, so I'm glad to be here. So I was asked to speak about the faces of poverty in Wisconsin, and the word faces might make you think I'd have snapshots. In fact, I'm going to provide statistics, but I'll try to do so in a way that your eyes won't glaze over. So the first half of my talk will talk about who is poor in Wisconsin, and in the second half, I will focus on public policies and what we've been doing in Wisconsin and how it has affected poverty in the very early years of the recession. And that will be citing findings from a report that came out earlier this year. I do want to thank my colleagues at the Institute for Research on Poverty at the University of Wisconsin at Madison who helped with this report. We got funding from HHS and the Census Bureau. And in developing this special Wisconsin poverty measure, which I'll be talking about, we did go around the state and talk to different stakeholders about what's important to measure about poverty in Wisconsin. For example, we adjust our measure for people in more rural areas having longer commuting costs, and that was something that was important when we talked to stakeholders in Wisconsin. But let me get to the first half before we get into our new poverty measure, just under the official statistics. And these were released just in September, so I put together these slides for you all. Who was poor in 2010? There's always a lag in your poverty statistics because you have to wait till the year's over and then ask people how much they made last year, and the Census Bureau takes about 6 months to process it. So it's in September we find out who was poor in the previous year. I want to start with the national context and a little bit of history. Thomas mentioned that the elderly poverty, which is the green line here, has come down sharply since 1960. It was more than 35% here in 2010. It's 9%, which I think is the lowest it's ever been, showing what Social Security has done for the elderly. The black line is the working age adults. The poverty rate was quite high for that age group, 14% in 2010. You can see it also, well, you can maybe see it clearer in the child poverty, which unfortunately is the highest. It goes up in times of recession. So you remember the recession of the early 80s and the early 90s, and the current recession that we're in. Unfortunately, poverty usually continues to rise even after unemployment starts coming down. So I do not think we've seen the peak. We project that, some of my colleagues at Brookings project that this national poverty rate could go up as high as 25% in the next couple of years, child poverty.